InnerQuest explores various pathways through which you can connect with the infinite wisdom of the universe and apply it to personal, professional, and spiritual growth. This program, featuring accomplished practitioners, educators, and authors, is provided by Infinity Foundation, an innovative center for holistic studies and research. We invite you to share this journey with us.
Hello, welcome to InnerQuest. My name is Jay Stone, your host for today, and our guest is Dr. Julie Milne. Welcome, Dr. Milne.
Thank you.
Is it okay if I call you Julie?
I'd love that. Thank you.
Okay. Julie today is going to talk to us about conscious dying and why it's important for us and for those we love and care about. But I'd also want to once more dedicate this to my friend David. Several months ago, I did a show with Susie Roos, who's a cancer specialist. If you haven't seen her show, it's worth watching it on the internet. But my friend has passed and his funeral's tomorrow. So it's a very timely topic for me and maybe for some people in our audience. But first, let me tell you a little bit about Julie's background. Julie is a certified instructor for dying consciously. She's a transpersonal psychotherapist, a Reiki master and practitioner. Julie has studied the practice of living and dying consciously since 2002. Julie has a private practice and volunteers her time working with patients with Midwest Palliative and Hospice Care Center. So, you want to tell our audience, because you really have a very interesting and diverse background, you want to tell our audience a little bit about your education and the jobs you've had leading up to this?
Certainly. I started out teaching nutrition on the college level to nursing students. So I was teaching interpretation of laboratory values and drug and nutrient interaction. So I was in the classroom 2 days a week and in the hospital with patients 3 days a week.
And would you take the students around with you to work with students in the hospital?
Exactly.
Yeah.
So I'd go in and visit their patients with them.
So it's like a teaching hospital,
Exactly.
like you see the doctors making the rounds with the residents.
Very much so. Lastly,
Okay.
I taught at Northwestern.
Okay.
So, and then took some time off to raise our family and got a master's in marriage and family therapy in the 90s, and then got a PhD in health psychology, which was really a wonderful blend of working in the medical field and in therapy.
Mm-hmm. Okay. So the topic today is conscious dying.
Yes.
And tell our audience, what is conscious dying?
From the conscious dying perspective, it is me making a choice on how I choose to die. It's saying there is so much more to the dying process than the physical process of that last breath of dying. It's taking everything about the person into consideration.
And when you said making a choice, what choices are we talking about?
The choice of who I would like to be with me during this whole process, how much I would like family and friends to be involved. Do I want to die at home? Do I want to die in a nursing home? What's pain level? Do I want to be completely pain-free if possible? Or do I want to have some sort of awareness, some sort of consciousness at the end so that I'm aware when I'm going?
Well, I know physicians in hospitals, nurses, they use a pain scale. Is that something that's used at the end of life?
The pain scale is used at the end of life. Hospice is wonderful as far as relying on the patient to say how much pain they have and trying to administer the pain in a pain-free way. It is very normal to have a lot of fear when one is experiencing death, or when one has been told that they have a cancer diagnosis, or even a friend, hearing a friend has a cancer diagnosis. Mm-hmm. The brain, through evolution, has been set up to survive. The brain knows how to survive. That's what we call our sympathetic nervous system. But so when we are afraid, when we experience fear or fear of death, it's interesting. There's a little structure that's in the limbic system called the amygdala, and it's like a doorbell. And it keeps pressing and pressing all these fears regarding death.
Well, I know a little bit about neuroscience and brain science. You talk about how the brain's programmed with the sympathetic nervous system, but there's the parasympathetic nervous system.
Exactly,
and
Jay.
so that's, to me, that's where healing takes place. And maybe if a person can't physically heal, a person can do mental, emotional, and spiritual healing at the end of life. And then there's a cycle between the amygdala and the hippocampus, which is for inward. The hippocampus is more inward, the amygdala is more outward. When the amygdala is active, we're more focused outward, more stimulation, and gathering information. When the hippocampus is active, it's for processing information, so that when we look out next time, we're more evolved than the previous time.
Exactly.
Yeah. So we're on the same page.
We're on the same page.
Yeah.
And even more so, Dr. Andrew Newberg, a wonderful neuroscientist out of Pennsylvania, has studied the effects of God and the brain. Mm-hmm. And so what he has shown is that it doesn't matter what type of prayer, what type of meditation you do, the guided imagery, the circular breathing, that wonderful deep breathing that we do with meditation, triggers also something called the anterior cingulate. And the anterior cingulate, as you may know, acts like a fulcrum between the limbic system and the frontal brain. And it's often in the frontal brain where, in meditation, when the monks reach samadhi, that the rest of the brain quiets down and the frontal brain is activated, where they experience that calmness, the sereneness, the oneness with God.
Well, I'll add on the cingulate system, it's the brain's gear shifter.
Right.
So if we're driving a car, we go from 0 to 50, and we have automatic transmission, the car automatically shifts from first gear to second gear and third gear, and so on. And so someone who's dying, their gear shifter, their cingulate system may get stuck, and so they can't flow. And they're stuck with those negative thoughts or the fear or the worry. And so the deep breathing or the meditation, etc., helps to unstick the gear shifter.
Exactly.
And that we can evolve and move on. And really, if we're stuck on a thought, we're certainly not conscious.
Right.
Yeah, because we're just focused on that one thought, and it's
we're focused
in our head.
On that thought and in fear.
Yes.
And that can be for the client, for the patient, or it can be for a family member. So part of the Dying Consciously movement is to train, to help train not only the patient, but the family or loved ones in guided imagery, in meditation, in the breathing process, to be able to teach them to sit there and entrain the deep breathing.
Like they do in Lamaze for pregnancy.
Exactly.
Yeah.
Yes.
Like the woman giving birth may have a husband as a coach or a friend, etc.
Right.
As a coach.
Right.
Now, isn't this ancient, this conscious dying?
Yes, it is. And it's certainly in Eastern cultures has been around a very, very long time.
Yeah.
But not here. In medieval times, dying was a very community event, and people came in, and if you were angry with the butcher, you made peace with the butcher. And there was forgiveness process that went on. There was a letting go. There was the community support of the dying person. In the Victorian times, it shifted back more very quiet. We don't talk about it, but we help the family in bereavement. And what happened after World War II is that we shifted from dying in the home to dying in hospitals. And in the dying in the hospitals, it took away so much control from the patient, the person, on how they wanted to die, what they wanted around them, who they wanted around them.
And also wakes. People used to have the wakes in the homes
in the
as
home.
well.
Right.
And so death was a normal part of life.
Exactly.
And so what can we learn from dying and death?
I think we can learn that it is so much more than the medical system makes it out to be. You know, as far as the medical system, at least in the United States, is concerned, the medical system is much more involved in how do we prolong life? How do we keep the person alive? And my experience from working and volunteering in hospitals and nursing homes is very much that the dying process is seen as only a physical process. So it's when the person takes their last breath, when the heart stops beating, and as such, it's seen as a medical event, sometimes as a medical failure, instead of as this was a whole person.
Yes.
You know, emotionally, psychologically, spiritually.
Well, one of the things that we psychologists talk about is coping mechanisms and defense mechanisms, and they're healthy coping and defense mechanisms. And because a person's never been so sick as he or she is at the end of his or her life, they need to use their coping or defense mechanism more than ever before. You want to say, you know, because I'm sure you've seen how your various patients, clients, people you assist cope at the end of their life. They have to dig deeper than ever before. They
are digging deeper, Jay. And you know, when one is facing the end of life, everything is up. And so many of those defense mechanisms, some of them come down.
Mm-hmm. And is that a healthy thing?
It's a very healthy thing, because one could have a defense mechanism of the ego being super strong, never being able to say that you're sorry or when you were wrong. But what we know from people who have had near-death experiences when they go into the light.
That would be me.
Okay.
Yeah.
And you may have met a celestial being, or you may have had a life review. And a lot of people, Raymond Moody has talked so much about this.
He's a physician.
Mm-hmm.
Yeah.
About how people meet a celestial being, and they go through a judgment process. They're taken back, some of them, to places they didn't make good decisions, places they didn't say something that might have been very kind. They're taken back to places of unfinished business. And people report that it feels like hours or weeks that it happened, when actually it could have been seconds or minutes.
Yeah.
So what this does when the coping mechanism comes down, it's a beautiful process, because it helps the person finish that incomplete business. And this is one of the aspects that's so important in dying consciously, is to be able to do a life review, to be able to go back and say the thank yous and the I love yous and the forgive yous that weren't saying.
Now, I just want to add, you know, you mentioned like people with near-death experiences. There's a wonderful organization our audience might be interested, International Association for Near-Death Experiences.
Yes.
They meet every Saturday every Saturday or once a month at Evanston Hospital.
Oh, okay.
So, yeah. So,
and they have a wonderful website. The international group has a wonderful website.
Yeah, the local chapter does too.
Okay.
And they have a wonderful speaker coming up, a physician. They often have, you know, highly regarded people, credentialed people. But you mentioned this life review, and it's becoming more popular to do a video. You know, so that the children, the grandchildren,
right,
the great-grandchildren have a chance to hear someone reminisce about their life. You want to say a few words on that?
No, that is an excellent technique, creating the video, asking questions. Another technique is giving the person a journal and having, let's say I do it for a parent, writing questions at the top of each page. So a question might be, let's say it would be for my mother, how did Dad propose to you? Mm-hmm. Or what was your favorite birthday? Or why? Or getting even deeper as to how would you like to be remembered? You know, and having them write down those questions. There's a wonderful technique that I use in workshops, which is wonderful for therapists and psychologists to use with someone, which is having them breathe deeply and go into a trance state, and then imagine that they're sitting by the edge of a river. And just allow whatever is coming down that river, see and tell their therapist what's coming down the river. Because that river represents the river of life. Mm-hmm. And you'd be surprised how much unfinished business comes up metaphorically coming down the river. For example, one person described a sheep coming down the river. And we were discussing it afterwards. Well, why was the sheep coming down the river? And she realized that she was the scapegoat, the black sheep in the family. Mm-hmm. And that she still held so much resentment and anger about that. And it gave us a tool then with which to help her release that anger and that resentment mm-hmm. before she transitioned. And
do you notice a change once people complete their unfinished business?
It's a huge change. Mm-hmm. There's a sense of calmness, a sense of peace, that letting go of guilt that was there before, and how healthy it is for the loved ones and the family members, mm-hmm. you know, to ask for forgiveness, to grant forgiveness, but the main thing for the dying person is for them to forgive themselves. Mm-hmm. It really comes from in here.
Now, I know in the Catholic tradition, there's last rites. What role does the clergy play in the conscious dying process, or religion for that matter?
Sure, and that depends very much on the individual.
Yeah.
You know, have they been religious? And a lot of people at the end of life, even though they have not been religious, suddenly want to see a priest for the last confession, the last rites, see their rabbi, whomever. Childhood prayers, psalms, have them read to them, gives them a sense of peace. But that's just so individual mm-hmm. to the person.
Well, what are you observing in your patients when, you know, as far as the role of religion and clergy?
It's interesting. I was working with one woman in hospice for the past 6 months who has severe Alzheimer's disease and constantly agitated, very, very agitated. And when I got her history, I found out that she had worked in a Catholic church and was Catholic. And what I found was that when I said the prayers like the Our Father, the Hail Mary to her, mm-hmm. it was not resonating. When I sang them, somehow it was reaching a different part of her brain, and she would totally calm down. And so I made a CD with Catholic, beautiful Ave Maria, Panis Angelicus, and brought in earphones for the CD player. And when she's agitated, they play the CD. It has Gregorian chant, other things from her upbringing, from her being in mm-hmm. the Catholic Church. And she just quiets down.
Yeah. Now, they're using that music and prayers as an intervention. Why not use it as a prevention? You know, instead of waiting till she's agitated to play the music or the prayers, do it on a regular basis.
Well, that would be wonderful. She's in a nursing home, and unfortunately, you know, if she were at home, I think it might be done more often. But again, in a nursing home setting, it's not done preventatively.
Well,
but that's a wonderful idea.
Yeah. Well, I've been meditating or doing self-hypnosis for 30 years, every day, at least once a day, most days twice, sometimes 3 times a day. You know, when I go through my dying process, I know I'm going to continue those practices.
Right.
You know, because it's been effective, and it's part of my personal growth process.
I agree. And I have the same thing. And see, part of the dying consciously is you and me taking responsibility for our dying consciously. So I have written down what I want at the end, that I want that wonderful sacred environment created with music, with soft lighting, with, you know,
Did you even spell out the music you
I
wanted?
did. I've got the CD. It's called my Transitioning CD that I have. And my children and husband know where it is. And, you know, I've been very specific. I have a wonderful soul sister that does beautiful energy work. I want her to come in and be sure my chakras are clean. All that, so, yeah.
Good. And you mentioned that a lot of people have unfinished business, you know, when you use that river exercise. Why are people having so much unfinished business?
Well, that's part of their defenses that you talked about before. You know, is we sometimes set up walls around us, particularly when we're ill. We are so vulnerable. You know, when you're dying, it's the loss of everything. You know, I think we've experienced losses of homes, losses of friends, but when you're dying, it's the loss of everything. It's the loss of that sunset. It's the loss of smelling the flowers. It's the loss of feeling the kiss on your cheek. It's the loss of everything. And so I think a lot of people tend to build walls around them to protect themselves from feeling that overwhelming loss, feeling everything that's coming up.
Well, I found, I've done some end-of-life counseling, that sometimes people are carrying around things from earlier in their childhood. People can be in their 60s, 70s, and 80s, and they're still, you know, upset because, you know, mama liked the other sibling better or something.
Right. So, you know, if one can talk, whether it's a clergy talking to them, whether it's a therapist talking to them. I had an incredible experience with a hospice patient where I went in the room and he said, I was praying somebody would come in, and just sat down with him and got talking and was able to ask about unfinished business. Is there anybody with whom you'd like to ask forgiveness? Is there any place that you wish you had said something, that you had said, I love you? Is there anyone you wish you'd said, I love you or thank you to, that you hadn't before?
And I'm a big fan of Dr. Daniel Amen, the neuropsychiatrist. One of his techniques is a positive memory album. And besides doing the unfinished business, do you also look at the positive things?
Oh, definitely. And that's something that can be very helpful, is having a gathering of family or a gathering of loved ones come, even in the last stages of death, and share what the person has meant to them. What are the greatest lessons they've given him? You know, what are they going to remember about him?
Well, my friend, he threw a party for himself, or we threw a party, and you know, I said, this is great. Well, let's do it again next Friday. And he said to me, Jay, he says, I won't physically be able to do it. And he was right. But it was a wonderful, wonderful event, and tomorrow's funeral, and I'm sure because of the way he prepared us, and you know, we've had a tremendous support group and friendship. You know, I mean, we've known each other for 40 or more years. That you know, it was just it's a terrible loss. But then I think about the bonds and the friendships.
Oh yeah.
So what could, if somebody we care about is terminally ill or seriously ill, what can we do to help that person?
You can hear and listen to what their wishes are.
Okay, fair enough.
And respect those wishes. I think it's also very important to go within and ask if there's anything that's triggering you about the death that you need to resolve, so that you can be totally present with your heart wide open, full of love, to help this person. The best advice, I think, when I went through my hospice training was one of the trainers said, before you step foot inside the house, if you're making a house visit or before you cross the threshold, stop and take a couple deep breaths. Let go of all judgment. Let go of all expectations, so that you can be with the person on their terms, so that you can hear and give them what they need.
Kind of like a blank slate for which the person can write a note.
Right.
Project. I guess that's projection, you know. Anyway, now let's say after a person has died, do you think we can, the loved ones left behind can communicate with that person?
I do, but I'm hesitating.
More important to finish it, but
right
before the death occurs. I understand.
Right, and the reason I'm hesitating is because people have reported, you know, in the Tibetan Book of the Living and the Dying, you've probably studied the Bardo or read about the Bardo, that they think it takes.
We only got like a minute or so, so we got.
Okay, but the point is being able not only to physically let go, but to spiritually let go of the person, so that they can go into the light.
Well, like one morning I woke up, it was like 2:30 a.m. and I go, oh, Esther, I gotta invite Esther over. And then the next day I get a call, Esther died in her sleep that night.
Wow.
So I felt like, you know, she sent me a message.
Yes.
And I didn't know she was making her transition. It was like, oh, I was so excited to see her. So if Esther heard me, I'm glad, you know, she knew how much I loved and cared for her and wanted to see her one last time.
Wow. Sounds like a very special relationship.
Well, she was a very special lady. I think we got to wrap it up. So for more information about Dr. Julie Milne, Infinity Foundation InnerQuest show, stay tuned to the credits at the end. Until next time, we wish you good health, good spirits, and good fortune. Thank you, Julie.
Thank you.
For more information about this show, our guests, Infinity Foundation, or any of our other programs, please visit our website, infinityfoundation.org, or call us at 847-831-8828.